The next topic is motherese. Parentese, baby talk, infant-directed speech, child-directed speech, all these are the synonyms of motherese. Motherese is the way a mother communicates or talks to her child or infant. The child is very receptive to the words mother is using, the sound mother is making, the pitch, the intonation, and from all these, the child develops a particular habit, takes the vibes from mother, and gives response accordingly. So motherese has a very important role in terms of the language development and habit development of a child. Now we will look at some of the points that are there with regard to CDS, which is child-directed speech, which is a type of motherese or a baby talk. Now, child development speech is a clear and simplified strategy for communicating to younger children, used not only by adults but also by older children. The vocabulary is very limited, speech is slowed with greater number of pauses, and the sentences are short, also grammatically simplified, often repeated. Although CDS features marked auditory characteristics, there are other factors also which aid in development of language. 3 types of modifications occur to adult-directed speech in the production of child-directed speech. The first is linguistic modifications, particularly prosody, including the simplification of speech units as well as emphasis on various phonemes. Then we have modification of attention gaining strategy, providing visual cues through body language, particularly movements of the face, to more effectively maintain the attention of the infants. Now, this is very important, that how the attention gaining strategies are used to attract a child's attention. Now, a key visual aspect of child-directed speech is the movement of lips. One characteristic is the wider opening of the mouth present in those using CDS versus adult-directed speech, particularly in vowels. The horizontal positioning of the lips in CDS does not differ significantly from that used in adult-directed speech. Instead, the observed difference lies in vertical lip positioning. By making the opening of the lips larger, infants are more likely to focus on the face of the speaker. Research suggests that with the larger opening of the lips during CDS, infants are better able to grasp the message being conveyed due to the heightened visual cues. Modifications to the interactions between parents and infants. This is important. Parents use CDS not only to promote language development, but to foster a positive relationship with their infants. The younger the child, the more exaggerated the adult's child-directed speech is. The attention of infants is held more readily by CDS over normal speech as with adults. The more expressive CDS is, the more likely infants are to respond to this method of communication by adults. Research indicates that infants do not play a passive role in this interaction, but engage interactively and are attracted to people who engage in CDS, child-directed speech. Through this interaction, infants are able to determine who positive and encouraging caregivers will be in this development. When infants use CDS as detriment of acceptable caregivers, their cognitive development seems to thrive because they are being encouraged by adults who are invested in this development of giving infants. Because the process is interactive, caregivers are able to make significant progress through the use of child-directed speech. To sum up, studies have shown that from birth, infants prefer to listen to child-directed speech, which is more effective than regular speech in getting and holding an infant's attention.